Are you struggling with hair loss that is caused by medication? Do you find that once you started a particular medication, you started to see more hair in your sink or more hair on your comb or more hair just around your bathroom? We're going to share today some really great tips that you can use to keep the hair that you have healthy and to essentially mask the hair loss that you have. This is Dr. Dwella Moten Nelson, your healthy scalp specialist. So I have talked to a number of clients who are on different types of medications, and they're trying to figure out, how in the world do I get my hair to stop falling out? Is there something I can take? Maybe we can ask my doctor, if there's something that I can use or something to take, or can I put something on my scalp, or, what can I do to help my hair to stop falling out? I definitely understand that's quite emotional. I've gone through hair loss myself, and it's really, really emotional to feel that, oh my gosh, my hair, my ponytail used to be this size, and now it's like can fit into a tiny little rubber band because I've lost so much hair. And when you lose hair, you do also have other things that show up, like stress. When you start to lose your hair and you start to see that hair in the sink, or you notice that you're losing hair, it is very stressful. There's a lot of emotions. I know you have questions about your hair growth, how to grow your hair in, what you should be doing. You may be a little bit nervous about asking a question, but I really, really want to hear from you because I want to help you. I want to help you to grow your hair in, to get your hair as healthy as possible. Please leave me messages below or comments below so that I can answer your questions. I'm here to help. That are wrapped up in us losing our hair and our hair not being as healthy as possible. But we do know that lots of medications have side effects when it comes to hair loss. You might be thinking, I might just get another pill to offset that. I am just not an advocate for that. I feel that if you're on a medication, basically, let's talk about how the medication works. So the reason that you might be losing hair is because that is how your scalp is responding to the medication that you're taking. So the medication, when you take something by mouth or you take something by injection or an infusion, all of your entire body gets a dose of that medication. So even if you are taking a Tylenol, your entire body gets a small dose of that Tylenol. Your liver, your eyes, your mouth, your lungs, your heart, everything gets a little tiny dose of anything that you ingest, that you take by mouth. So if you're taking a medication by mouth and you're starting to see hair loss, then your scalp is responding to the medication that you're taking. I never, never, never recommend that you stop taking any medications that have been prescribed for you, because your doctor has said that those things are going to be beneficial for you. But I will recommend that maybe you talk to your doctor about other types of medications that may not have that same side effect. So if you're taking a blood pressure medication that's causing your hair to come out, there may be another blood pressure medication that does exactly the same thing that does not cause you to lose your hair. So those are the kind of discussions that I definitely recommend that you have with your primary practitioner, with your family doctor or your primary doctor, just to chat with them about the fact that you're losing your hair. Don't be nervous about talking to them about you losing your hair. I think sometimes when we go to doctor's visits, we don't want to really tell the doctor what's going on, and I don't know why we do that. I've done it too, where you go in and you're like, well, I really wanted to tell the doctor that this was bothering me, but I don't want to waste his time with hair loss because I'm going in here about blood pressure, right? But everything's connected. Everything in your whole body is connected. So make sure that when you're going in to talk to your doctor about whatever the medication, share with him any side effects that you have. So if you have a side effect of losing your hair, make sure that you do mention that to your doctor as well, because there may be another medication that he can recommend that doesn't have that side effect. But if you're seeing hair loss when you're on a particular medication, it's simply because that is how your scalp is responding to that medication. There are some things that you can do to try to keep the hair that's on your head and keep that hair growing. So if you're losing hair because of medication, basically the way that I look at it is you want to increase the hair growth on the scalp if you can. And you want to keep the hair that you have healthy and growing if you can. So a couple of tips to do that. One would be scalp massage. If you massage your scalp, I would always recommend massaging your scalp daily. You can either do a scalp massage with your hands, or you can use a tool to do a scalp massage. If you use your hands, try not to use your nails when you kind of dig into your scalp and scrape your scalp, it actually can end up damaging the skin on your scalp. And you don't want to do that. You want to do a very light massage on your scalp and not scrape it with your nails. So I love massage tools. We have a manual scalp massage tool that's offered by Dr. Topic Oils. We'll link that for you as well. But it's a really inexpensive way for you to be able to massage your scalp without having to worry about scratching your scalp or damaging your skin on your scalp. So doing a scalp massage is a great way to increase the circulation on your scalp and keep your scalp very healthy, keep your hair growing. Another tip, if you have any bald spots, use a derma roller. We talked about that. And we can also link that video for you to look at. We talked about the importance of you using a derma roller and how you can use it and making sure that you're not damaging your scalp when you're using it. The third thing I'll say is you can use topical sprays and serums and pomades that you can use on your scalp. Just making sure that you look at the ingredients. I'm an ingredient person, so I always want to know what's in that formula, if it's organic, if it's vegan, if it contains anything that might be an allergen. And luckily in Dr. Topic Oils, we do have the Nutritive Scalp Elixir, which is a serum, and it is vegan. It's nut-free and dairy-free and gluten-free, and it's also cruelty-free. And so those things, if you're looking for something that's vegan and that has very high quality essential oils, I recommend using something like that. If you don't have an allergy to sulfur, sulfur is one of the greatest building blocks when it comes to growing hair. And alopecia repair balm is something we offer as well, and it has sulfur in it, but many people have a sulfur allergy. So you, of course, don't use it if you're allergic to sulfur. So with those couple of tips, you will be able to keep the hair that you have on your head, help to grow hair thicker. And even though you might lose more hair than you're used to seeing, the density of your hair on your scalp will remain. So that's really the main thing, trying to keep your density of your hair on your scalp and trying to keep it looking healthy. So I hope that this is helpful. So you can leave your comments below. We love hearing from you. We love hearing your comments, your questions. If you have questions, please drop those as well. And we look forward to hearing from you soon. This is Dr. Dwella Moten Nelson, your Healthy Scalp Specialist. Bye.